Hi, my name is Cassandra Doughton, physical therapist since 1993, and I will be teaching this ABC after breast cancer exercise and education class today. Now, if you're watching this video, it means you've had breast cancer or you're about to undergo some of the treatments for breast cancer. My goal is to teach you what you need to know to kind of be your own therapist, to protect that arm from injury, protect against infection, protect against lymphedema, and to get that arm moving and normal again. Now, after your surgery, it's going to be a slow process. It might take 4 to 6 weeks to kind of feel like yourself again. You have to kind of gradually work up to improving your flexibility and your strength. I'm going to give you 5 main steps. Number 1 is protecting your arm. Why do we protect your arm? We protect your arm because when you've had lymph nodes removed, either the sentinel node biopsy or radiation to the lymph nodes, your lymphatic system in that quadrant is less effective. You want to protect your arm against things that cause constant pressure, like a heavy handbag or a tight blood pressure cuff on that arm. You want to protect your arm against sunburn by putting sunblock on your arm. You want to protect your arm against bug bites by putting bug repellent on when you're outside. You want to protect your arm against injury, so avoiding vigorous repetitive movement like scrubbing the floors or shoveling snow. You're protecting it from skin injury. You're protecting it from a muscle strain or muscle pull. Anytime you have an injury to your arm, your body has to bring more blood or fluid to that arm to heal that injury, and that puts a little bit more demand on the lymphatic system, which is not working up to par like it used to before your cancer. If you do get a scratch or a puncture of the skin, you want to wash it with soap and water and use first aid ointment like a Neosporin and watch it for signs of infection. Do you know your signs of infection? The top 2 signs for infection is redness and warmth. You are more susceptible to skin infection or cellulitis after you've had treatment for breast cancer. I have had people who have not seen any cut in their skin, but all of a sudden they look at their arm and it's, wow, it's red and it's hot. It looks like sunburn, but I wasn't out in the sun. That's an infection. Apparently the bacteria had gotten into the skin, into the tissue, either by cuticles that were torn or just some minute way. So you want to be extra careful and just know your warning signs of infection so you can quickly do something about it. Number 3, watching your arm's tolerance to progression of activity. What does that mean? How do you assess your arm? Same way that you've assessed your breast in the past to make sure that there's no new lumps or new issues, you would also assess your arm, especially after doing a new activity. Hopefully you're doing that new activity gradually. So what you would do is, the first thing you would do is check your hands and see if your knuckles look like the same. You would pinch up on the skin to see if it can pinch up evenly on both sides. You want to look at your veins and your tendons to see if they look symmetrical and normal. You're looking at the indentations at the wrist, kind of the contour of the arm. You're just kind of looking for asymmetries or things that just don't look normal like they used to. A little more swollen, a little more tougher, or harder, firmer skin, denser skin. That's what you're looking for. You can look at the elbows in the mirror. Some people don't even notice if they have new swelling because they don't wear shirts that are form-fitting. So that would be something to look for. If you do notice signs of swelling, you want to call the doctor again and let them know so they can have you come in to see me so I can tell you what you do now if you already are starting to have signs of lymphedema. Number 4 is gradual return to exercise and activity. Day 1, right after surgery, they've did surgery on this part of your body, but you can still move your hand to keep the circulation going. You can move your wrist. You can move your forearm, you can bend and straighten your elbow, and then we can start doing some shoulder exercises too. You'll also want to look into kind of restoring your normal function and your normal posture. You want to protect your arm against injury, but you don't want to guard and protect your arm against normal function. So some of the normal stretching exercises would be slow, deep breaths. Those are great. If you do what's called diaphragmatic breathing, you're actually using your diaphragm to take a bigger breath, and it actually increases lymphatic flow. Other exercises that you could do are shoulder rolls. You can circle them up and forward or back and around, and you're looking for the symmetry. You want to make sure each shoulder lifts up the same like the other shoulder. Another one is a good one is squeezing your shoulder blades backward together, like elbows back, chest out. You can even lift your head like in the Titanic pose of Rose. Those are good stretches to do. Usually initially you might do it just for 5 or 10 seconds. And as you get good, some of these bigger stretches where you can say, ooh, that really kind of stretches that tight area, then you'd hold it longer, up to 20 to 30 seconds. Another thing, a lot of times when you're kind of guarding your arms, sometimes we tend to be bent forward, and it's a good thing to do is to stretch backwards at your back, putting your hands at your hips and bend backwards either while you're sitting or while you're standing, just to make sure your back doesn't get too tight. Some of the stretches you can do for your shoulder would be a pendulum stretch. You actually stand up, bend over, and dangle your arm, and then just let it swing like a pendulum, either left and right, forward and back, or in a circle. You can kind of rock your body to get that motion. It's a good way to get your arm away from the side of your body initially if you're really kind of cautious or fearful of doing it. Another great exercise is the table slide, where you sit in front of a table and you put your arm out there. You can either rest your whole forearm and then lean forward until you feel a gentle stretch. When you feel that stretch, you just kind of hold it right there. You don't want to go until you're like, it hurts. You want to ease back on it just to a gentle stretch, and then hold it right there. You can do it forward, and you can also do it sideways and lean. So you're getting that motion of, this is called abduction, is out to the side, and forward is called flexion of the shoulder. Once you get all the way where you're like, ooh, that feels tight right there, whether it be tightness in the arm or tightness in the armpit or in the scar, you can put your hand right over that tightness and gently just pull on the skin. Just pull. You're not trying to separate the scar or anything. You're just pulling on the skin and stretching that area. Your goal is to kind of improve the flexibility of the arm, of the armpit, of the chest, so that feels just as normal as the other side. The muscles, the skin, everything needs to be just as flexible despite the scar that you now have. Definitely start holding your stretches up to 20 to 30 seconds. You should notice that after a few days you can move your arm a little farther. Another really good stretch to stretch your pectoral muscles that go across the front here is to get in a corner or a doorway, having one foot forward, so you can kind of shift your weight onto that forward foot, and you would stretch across here. So let me show you. You get in the doorway, put one foot forward, put your arms out to the side, lean in till you feel gentle stretch across the chest. You can put your arms in one of 3 different positions to kind of isolate a better stretch that seems to pinpoint or work the area that you need most work on. You can either have your elbows lower than your shoulders, which would be like the W position, and lean in. You can have the T position where your elbows are at the same height as your shoulders and lean in, or where your elbows are higher than your shoulders and lean in. Any of those 3 positions, you can stretch your pectoral muscles, the different kind of areas of your pectoral muscles. Another great stretch, just like the table slide, is called the wall slide. The doctors usually say walk the wall, so they have you kind of walking your fingers up the wall. You can do it like that, or you can slide up the wall. I find it easier to put my elbow on the wall too. and lean into the wall to stretch up as high as I can till I feel gentle stretch. Once I get up to the very high part, then I'm going to pull on my skin and gently stretch the tissue. And when you pull on the skin, you can kind of hold it for a few seconds. See if you can get it to loosen up a little bit. Another excellent stretch is putting your hands behind your head or at your top of your head and leaning your elbows outward. If you're laying down, gravity kind of helps and helps you stretch kind of the pectoral area. It's a great stretch in preparation for getting radiation, because you have to hold onto a bar and let your elbows stretch outward. Another stretch that's good, we've stretched outward rotation. We also want to stretch inward rotation, like if you're going to go reach to touch the back of your back. So if you're having trouble reaching to your back, you can put a cane or a towel or a stick and just kind of pull it up with your unaffected arm and just stretch there. It's a good way to stretch so your hand can reach behind your back again. Let me tell you about the lymphatic system. It's a little bit different than the circulatory system. The circulatory system has your arteries that turn into your capillaries and feed your cells, and then any of the wastes or fluid or blood is returned by the venous system, and then it goes back into the heart, and the heart pumps it through again, collects oxygen from the lungs, that kind of thing. With the lymphatic system, it's not a big circle loop. It is a one-way system starting at the fingertips and going up, and it eventually drains into the subclavian veins. Right here, from the legs, it goes up into the abdominal lymph nodes and up the thoracic duct, again into the circulatory system right here at the neck. The lymphatic system moves by you moving your body. So when I move my arm and those muscles pump against the lymph vessels, it actually helps push on the lymph vessels to help push the fluid out and increases the lymphatic system. The lymphatic system also works by gravity a little bit. When you elevate your arm, it helps pull the fluid out of the arm. The lymphatic system goes from high pressure to low pressure. So if there's lower pressure in the chest area, it will help suck the fluid out of the arm. So how do you get lower pressure in the chest area? Well, you do that by doing diaphragmatic breathing. Your diaphragm is a muscle that's kind of shaped like this, and it goes from the front to the back, right below the rib cage. And what it does is when you take a deep breath and swell your belly out with a big breath, it lowers down and allows more air to fill into the chest area, and therefore sucking the fluid out of the arms and increasing your lymphatic fluid. To do lymphatic breathing, put one hand on your chest, one hand on your belly, and when you take a deep breath, your belly hand should swell out. Let's try it. Ready? Try it again. You see how my belly hand swells out with a big breath? So being in the habit of taking good diaphragmatic breaths 10 times, a couple times a day, is a great way to improve your lymphatic circulation. What is lymphedema? Lymphedema is a buildup of fluid underneath the skin. This fluid is called lymph fluid. It is protein rich. If there's any blockage or damage to the lymphatic system, then there's a backup of this fluid causing what's called lymphedema. Lymphedema is caused by radiation or cancer itself or removal of the lymph nodes, usually not by the actual breast surgery, including the mastectomy or lumpectomy. How can you decrease your risk of getting lymphedema? Good question. You can decrease your risk for getting lymphedema by being wise with your arm. To decrease your risk of getting a cellulitis or skin infection, you've got to take precautions. protecting your arm in that quadrant that was affected. So it's pretty important to decrease your chance of getting lymphedema or infection by following what I've instructed you on. And this is not just something you would do for the next month or year. It's something that you would do for a lifetime, just to be aware and be a little more cautious on that side compared to the other. You also want to make sure that you have the same flexibility on this side as you do this side. If there's any tightness, we've taught you some stretches that you can work on to kind of loosen this area up so you have full mobility, so the lymphatic system is not blocked in any way. There is no specific weight limit that you can't lift. You just want to do it slowly and gradually and gently. It's not a no pain, no gain kind of thing. It means starting off with, let me just do the motion that I'm trying to strengthen, whether it be lifting your arm overhead. Let me do it without a weight. If I do pretty good with that, then I can start with like a 1 pound weight, like a can of tuna. Can I lift that up? All right, that feels good. I can do 10, 15 of those, no problem. I can check my arm in between. Is it doing okay? Is there any pitting? Am I noticing swelling or tightness or fullness? Does okay. Keep kind of progressing. You can go up to 2 pounds. You can go up to 3 pounds, but you have to just really think about doing it gradually. Lymphedema can develop weeks or months after cancer surgery. It can develop up to 20 years later. There's no true prevention for lymphedema, but if you follow the steps that I've given you, then you should greatly reduce your risk of getting a lymphedema. Keeping a healthy weight is so important also for reducing your risk for a return of cancer as well as lymphedema. You may want to get a compression sleeve or gauntlet, which is a little hand piece to wear if you like to fly on an airplane. The low cabin pressure or possibly even pulling heavy luggage has been known to trigger lymphedema as well. Lymphedema is not something that has a cure at this point, but we do know ways of managing it and reducing it. Treatment entails what's called manual lymph drainage, which is a massage technique where you're redirecting the fluid from the affected side toward the opposite side in the armpit here or down in the groin here and to the neck as well. And a trained therapist can teach you how to do manual lymph drainage. You can do manual lymph drainage on you as well. If you were doing it on yourself, you might do it 15 minutes daily. You would have to assess for yourself how much it helped with reducing any tightness or swelling or fullness, and sometimes it helps reduce pain as well. So manual lymph drainage is a good tool to have. If you notice swelling starting to develop, ask your doctor to send you to a lymphedema therapist so they can help guide you into managing this swelling so it doesn't continue to worsen. Let's talk about scar mobility. If I have a scar going across my chest here, I'm going to pinch it like it's a scar here, so I'm pinching it. If I lift my arm, ooh, I can only go that high before that scar area starts pulling. Just kind of the skin. I'm just grabbing the skin and it was too tight to reach over my head. So it's important for that scar to get full mobility like the other side. So what you want to do is put your hand directly on the scar. You can move it in all directions, left, right, up, down, or any of the diagonals. If it feels tight in any of those directions, you're going to kind of pull it that direction and hold it for like 30 seconds. And you're just kind of stretching the fascia, loosening up. You would go in all parts of the scar and assess it up, down, left, right, and all the diagonals and find out which way it's tight and not loose and not moving. And you would help improve the mobility by working on your scar. What is cording? Cording is where you get a tightness, a drawing of the skin in the arm at the elbow or at the armpit. A lot of times you'll see it and it looks like like a cord, like a guitar string kind of thing. And what you want to do is stretch on it by using your, doing the stretches that I showed you, but you can also put your hand on either side of the cord or the tightness and pull. So one hand would be here, another here, like you were pulling apart and gently stretching and holding it. And then I kind of change my hand position a little bit and do it again. Hold it for like 5-10 seconds and then grab it again and pull. And you're basically trying to release that cording. The cording is a lymphatic vessel that's inflamed, and you can release it gently. My goal is to empower you to be able to move your arm confidently and freely again, to improve your strength, decrease your risk for infection, decrease your risk for lymphedema, and allow you to return to your normal activities and improve your life. If you have any questions or concerns after watching this video and you'd like to contact me, you can contact me at C. Dowtin, D-O-W-T-I-N, at wakehealth.edu. Thank you so much for listening. I hope you feel empowered to get your arm and your chest and your shoulder back to normal, that you feel safe in moving and you kind of know what to expect and how to improve so you can be the best you that you can be. All right, good luck.